Depression is an emotional state of mind characterized by feelings of constant sadness. Depressed people can succumb to obsessional thoughts of self-blame, suicide, guilt, and often have an inability to perform everyday functions. They have trouble concentrating, and unlike many teenagers, they also lose the want to care about their appearance. Those with a history of depression within their family, perfectionists, and even mental illnesses such as schizophrenia may also add a high chance of giving a depression.
Depression is a medical disorder, and it's a mood that's down in the dumps, depressed, anxious, tense, nervous, for more than 2 weeks, pretty solidly. If a teen thinks his friend or her friend is depressed, probably the first thing you should do is talk to that kid. It's the third leading cause of death in teenagers. It's treatable.
Often when a teenager abuses substances, it's also to mask the depression. It's to gain relief. It's like taking medicine. It gets them out of the pain. Some of the symptoms of clinical depression include this dysphoria, this down mood, this sullenness, the face drops, all the life goes out. It includes a lack of interest in what used to really excite them.
Teenage depression, adult depression are different. So the teen depression, is more irritability. It's not having interest in things that they used to have interest in before. It's really a shift in the person that you knew more so. So it's to the nth degree. It's not just that typical irritability in teenagers.
What are some of the things that we can do to help someone who we fear might be reaching that point?
Yeah, it's really important to ask a lot of questions to get them help. It sounds like Marie Osmond had been working very hard to get him as much help as possible, but to really encourage their children to be active participants in their therapy, because that's really the most important thing, is figuring out how to be not hopeless anymore, but move towards a life worth living, and he couldn't get there. I think it's so important. The first thing you have to look for is there any significant change in mood? Teenage depression doesn't look like adult depression. They may still be going about their business, and they may still go to school, so they have to be aware of any change in mood. Are they giving possessions away? Are they avoiding activities they used to like? Are they saying goodbye in ways that make you uncomfortable? It's kind of the subtleties that you need to be aware of so that you can jump in and ask them if they need some help. The first thing I think parents need to remember is that kids that are contemplating suicide are contemplating suicide. So ask them if this is something they're thinking about. Ask it in an open-ended way. If you don't ask that question, they're never going to be able to.
You have to be that specific.
You have to be that specific. And don't be afraid to put the idea in their head, because you're not going to. If they're having the thought, it's there already.
Right. But how do you go about talking to a teen who's not interested in engaging with you?
And there are many. You have to encourage them to talk to somebody. Maybe they don't feel comfortable talking to you as their parent, but maybe there is a trusted adult that they can go to and